Hello and welcome to my 21st CPD Coffee Time session with me, Dr Tina Rae. Today I'm going to focus on supporting children with emotionally based school phobia in the midst of this COVID-19 pandemic. The reason I have opted to focus on this at this point in time is because I've been receiving copious requests from fellow Twitterers and also via other means asking for this at this time. I think basically because it's something that we're all incredibly aware of, the fact that there is an increase in anxiety around the imminent transition back into school in about 10 days time. And also I think because there are many parents, certainly that I've spoken to in recent weeks, who said they are really fearful that their child may be becoming very frightened in the first instance about actually going back into the school context. So hopefully this session will be really pertinent and relevant to today. And just to briefly flag up again, I was formerly a teacher. I'm now working as a consultant psychologist for Compass Fostering and in many other venues, educational, social care settings across the country. I'm also a prolific author and have written extensively for Nurture UK, my favourite charity, my charity of choice. So you'll find many of my publications all primarily focused upon well-being, mental health and promoting the well-being and mental health of children and young people in particular. I've also written extensively for Hinton House Publishers for the wonderful Sarah Miles, and I'm going to be making reference today to the new publication, the new Wellbeing Toolkit for Mental Health Leads, which also has a module on the topic of school phobia. So I'm making reference to a framework from that resource today. So what are the aims? I'm going to define school refusal stroke avoidance, and I'm going to come back to this notion of the language that we use in particular around this area, but the impact and specifically within the context of this current COVID pandemic. I'm going to highlight some of the adverse childhood experiences that result in toxic stress and the link between this toxic stress and school refusal, and also the links between attachment, toxic stress and school refusal. There's clearly a link between all of these key elements and factors. I'm also going to hopefully clarify what actually works in terms of re-engaging with children and ensuring that they feel safe and able to return gradually in a step-by-step process back into the school context. So I'm going to focus on highlighting the importance of relationships, connections, emotional connection, team approaches around the child, and some of those therapeutic interventions and relationships which really do support the development of systems for effective reintegration. Thambiraja et al. Were really seminal in this whole area in terms of their work on what was then referred to as school refusal. And they maintained that school refusal basically occurs when the stress exceeds the level of support that the child has, when the risks seem to be greater than resilience, and when the pull factors that promote school non-attendance overcome the push factors that encourage that attendance. If you're doing this on your own, just listening to me on your own, or if you are engaging in this session with a few colleagues, possibly once you're back into school in September, you might want to just pause at this point and think about what you would regard as the triggers, the main triggers to school phobia stroke avoidance, and also what might be some of the specific impact of COVID-19. Obviously, I'm going to talk about that in a few slides, but it would be very useful perhaps just to focus on that and get some ideas and generate some ideas and see where any similarities and differences and agreements might be. But at the outset, I do want to just flag up this thing about our language and the language that we use when we're talking about emotionally based school avoidance. I've used the term refusal here. You'll see the word phobia. The literature makes reference to these. So frequently throughout this, when I have this presentation, when I'm making reference to someone else's work or when I'm quoting someone who's researched in this area, they will have used those terms. So I just want to flag up that that is not my preferred terminology. I found this wonderful quote from Steve Russell on Twitter a few weeks ago. He said, "The language we use really does matter, as the words reflect the lens through which we see the behaviour and which others are then invited to use or adopt. So school refusal, the term refusal, strongly infers that behaviour is deliberate or chosen, that the child has some level of autonomy in choosing not to go to school. They're choosing that, they're making that choice. That does have some significant implications for the possible responses, suggesting or potentially prompting those which may be more punitive in nature. If we deem this to be deliberate or chosen, we will be less likely to tackle this and support the child in a nurturing, therapeutic way, which is exactly what they need when they are suffering with emotionally based school avoidance. Okay, so I'm quoting here, but I would want to flag up at the beginning very, very strongly that my preferred terminology is emotionally based school avoidance, EBSA, which is why I've used that term at the outset. So school refusal, avoidance, emotionally based school avoidance, absenteeism, adverse childhood experiences or ACEs. The intersection of toxic stress here, mental health and school attendance is something that I want to flag up in this session today. And there is this link, low income, homelessness, transient families. Of course, those impact very, very strongly and obviously on children's school attendance. And I think this little diagram visual does make it quite clear, this intersection of mental health and school attendance here. So the adverse childhood experiences such as mental illness in the home, physical, sexual, emotional abuse, violence in the home, parental divorce, separation, emotional neglect, a family member being in prison, or domestic violence or psychological abuse. All of these result in the kind of toxic stress or trauma that can directly lead to non-attendance or emotionally based school avoidance. And the UK literature that we have available currently reveals that between approximately 1 and 2% of the school population, with the slightly higher prevalence in secondary school students, are absent from school due to emotional reasons, not because they're truanting, not because they're making a choice, but due to emotional reasons. And of course, there's a huge amount of research around the fact that transition from primary to secondary school, this is particularly from Evangelo et al., really does show that there's an increased risk of toxic stress at this point in time. It's a difficult time for all our children, but for those who are transitioning from vulnerable groups, so those who are really most at risk with ASD, ADHD, mental health needs, self-harming behaviours, etc., or special needs that are really, really complex, this is going to be far more difficult and complex for them in terms of making this transition. And we see all our kids make a drop academically at this point in time, even those who present as seemingly resilient. And I think this has real resonance now for this current transition back into the context of school in the midst of a pandemic, when there's an awful lot that we really clearly feel that we cannot control. And I'd make reference to the transition toolbox from the wonderful Nurture UK team here. I wrote this for them a few years ago, and I think it's probably come into its own during the last couple of months. And I know that this resource has a huge amount of really, really relevant and pertinent activities, totally relevant for transitioning children and young people back in during this COVID pandemic. So please do take a look at that. So what are the warning signs? What should we be looking out for when we are concerned or worried about our child becoming really anxious about school and not wanting to attend? There will be heightened levels of anxiety, more displays of anxiety, perhaps a decline in punctuality, getting into school later because there's a reluctance to get up and to go into school, more negative talk about school. If we're listening to the narratives, the words that the children and young people are using, instead of being upbeat and positive, they'll be making reference to all the things that are not good, that are bad, that they're unhappy about. A reduced level of engagement in academic learning, in the social aspects of school, sometimes atypical behaviour that is really not like my child, is what parents say to me, or really, really strong displays of anger, anxiety and stress. And it's important to remember the kind of the way in which we experience stress, I suppose, and the fact that sometimes those mild levels of stress can be very positive. They can help us to engage more effectively in the curriculum and learning, etc. There's a brief increase in our heart rate, mild elevations in stress hormone levels. A tolerable level of stress is that sometimes it's serious temporary stress responses buffered by supporting relationships. So even when things get really, really bad, we're maybe experiencing a bereavement or parents splitting up, or we are really, there's an element of bullying or something going on in the school context, we can actually get through this when we have that buffering provided by the social context, the relationships, those therapeutic relationships that we have with others. And then there is toxic stress, and that's when this prolonged activation of stress response systems is there in the absence of any of these kinds of protective, supportive, nurturing relationships. But it's important that we flag this up. Again, it's a continuum. Many, but not all children who are chronically absent from school suffer from the effects of toxic stress. So just to flag that point up. So emotionally school-based avoidance, I'm going to refer to it as EBSA as far as I can from now on, unless the researchers make reference to school refusal. It traditionally occurs, EBSA, when there's a transition, as I said earlier, between primary and secondary school. There is a loss of bereavement within the family, so a significant loss of someone that they've loved dearly. There may be a change in friendship groups or bullying, or a prolonged absence, perhaps due to illness or a move to a different area, etc. The change in friendship groups obviously has great resonance for all our children and young people, as does bullying. And I think just pertinent to this at the moment is thinking about COVID, and a couple of the children that I've had discussions about over the phone to parents recently have been very distressed going back into school in July for the last bit of the summer term, when they were placed in bubbles, and felt very anxious about the fact that they were not included in those bubbles with friends that they knew very, very well. So they felt this kind of lack of attachment to the new group. And I think we need to be very cognizant of that moving forward, that we promote these levels of attachment and bonds within the groups. And we're very clear about ensuring that as far as possible, we can maintain some of those friendship groups. In essence, I suppose, when I'm thinking about COVID-19 at this time, all of these triggers can be associated with this pandemic, and in many respects in ways that need very little further illustration. And I think we can therefore predict that many, many more pupils and their families are now going to struggle with this issue. And again, this may not be particularly obvious at the outset. It may become more apparent once children have been in school for a few weeks. And it may also be re-triggered by a future lockdown or cases of COVID within the school community, where the school has to then be shut down for a period, deep cleaned, etc., etc. So we need to be very clear about this. We can make this prediction, but not with absolute certainty in terms of the statistics, clearly. So thinking about COVID and this current situation, separation anxiety, I do think will be increased for some of our children and young people, because finding this kind of struggle, having to manage that, being separated again from parents or carers when they've had a sustained period of time at home, that might really impair an easy return to school. And that ability to remember how they functioned independently from loved one previously, from their parents, carers, that may have diminished. So we need to work with them to ensure that they look back and reflect upon the positives and how they were able to do things before, in terms of actually being independent, going into school, accessing their work, looking after their things, organising themselves, etc. There's also possibly a fear about the well-being of family members. That's often a key feature of separation anxiety in children and young people, but it may really be heightened at this time when there is clearly a real and evident threat of potential harm befalling them with the ongoing coronavirus pandemic. Sensing and absorbing the anxiety of other family members may contribute to their sense of danger at being back at school. So again, this has implications for how we talk to our children, how we nurture them through what we can and can't control, how we focus on the positives, how we focus on being together, building connections and keeping each other safe, and ensuring that our children know that we feel that we can keep ourselves safe if we follow the right guidance and rules. So again, that there are real implications for parents, carers and teachers and those in the caring professions as to how we support children with this kind of anxiety. And also social anxiety. Lockdown will have had its many haters, and there are many, many children, the majority of children that I am aware of currently in my local area here in Kent, I would suggest are looking forward to going back to school, really desperate to be playing with their friends and engaging in learning again. And for some, though, with social anxiety, this may have felt like a total blessing. And I've talked to parents of children, particularly with ASD on the continuum, who have said that basically they found it a wonderfully relaxing time because they didn't have to go out. This has been an absolute blessing for them. They've been able to do all the things that make them feel comfortable within the safety of their own home. And the problem is when we look at this and think, actually, don't go out at all unless it's essential. Stay at least 2 meters away from others. Don't mix with anyone not in your household, etc. No social gatherings. This kind of social distancing is in essence a script that many with social anxiety might actually embrace and have found quite healthy. So returning to school when there's a requirement to mix again with both peers and adults could trigger higher levels of distress. So we need to be very, very conscious of these children and flag them up at the outset as they go back into school. So making sure that there are these really good communication systems between home and school, that the parents are actually saying, look, this has been really easy for her. We need to actually now help her to get back into a context that she's now going to find very, very difficult. And again, generalized anxiety, those struggling with multiple worries share the common experience of having difficulty in coping with uncertainty, not being in control. And this change to lockdown took away any sense of certainty and routine that many children and young people had used to make themselves feel safe. So support for those battling with generalized anxiety may have centered on them exploring how likely or unlikely bad things are to happen. Unfortunately, with the coronavirus outbreak, the levels of uncertainty have escalated extremely, very, very much so. And this pandemic has really given agency, in essence, to those of us who are negative thinkers. So returning to school can present many demands for them. So learning to sit with uncertainties during such uncertain times will be a challenge for many. And again, there's going to be a need for us as the adults who are caring and nurturing and ensuring their safety, that we focus with them on really recognizing what they can control and making sure that they feel safe. And at this time, during this pandemic, those with health anxiety, those specific worries about the health of yourself or others close to you, has been for some of us pretty overwhelming. And learning that an everyday symptom of a cough or a fever might indicate something deadly is likely to drill deeply into the worries of those who suffer already with health anxiety. The virus is contagious by everyday close contact with others, and this might only add to the fear that they have previously experienced. So I think it's really, really important trusting medical experts and scientists for some of our children and young people, and now their parents and teachers. And that it's okay to be around others might be problematic. So this is going to take work. So this, we're going to need to do some lessons, some tutoring, to some support sessions around how we keep ourselves and each other safe, and we can manage this health anxiety effectively. And unfortunately, for those with OCD, with contamination fears, having a deadly virus transmitted by contamination from others is something that they will have long, long feared. And the rules around hand washing, careful cleaning, wearing PPE, staying physically distant, etc., may be the compulsions that they have actually been battling with or learning how to reject over time. But now it seems, oddly enough, as though these compulsions are the things that are keeping us safe, and we're advised, even instructed, to make use of them and engage with them. So how to move on from these rules when appropriate may present a massive challenge, and relapse is a very real possibility. So again, there's this, I think, message to us around we need to ensure that the education is appropriate here, and we are not actually raising these contamination fears. We're doing as much as we can to minimise them. So clearly, understanding how to respond to these anxieties is absolutely essential at this time. And I would make reference back to my second CPD session in this series, which is focusing on anxiety, if you would like some more information, tools and strategies, grounding, relaxation, etc., in order to help support children with anxiety manage it more effectively. So if the school response is appropriate, if we are appropriately responding to issues around EBSA, school refusal, emotionally based school avoidance, then the starting point is to distinguish it from the other causes of persistent absence. And this is the process of procedure traditionally that we would undertake when we are beginning to assess what the issues are for an individual child, so that we make a distinction clearly between the emotionally based avoidance and that which is a choice And let me just flag this up. I don't really think that any absence is usually a choice. There's always an underlying reason or difficulty here. But this is Sam Biduras and et al.'s chart, which is traditionally used when thinking about school non-attendance, distinguishing what it is. So are there any medical problems? Yes. So this is a physical illness. School non-attendance. Do parents know the whereabouts of the student? No, they don't. So then this would be classed as truancy. Are the parents concerned about school non-attendance, emotionally based school refusal? No. Then the parent has condoned the absence. Does the student show significant distress in attending schools? Then yes, we would then refer to this as school refusal, or I would refer to it as EBSA. And what do we need to be asking at the outset? How stressed is this kid? How stressed is this family? And what we're looking for: poverty, mental illness, addiction, domestic violence. We're looking for adverse childhood experiences. We're not measuring them. I really don't think that the measuring tool is particularly helpful. And there's a huge amount of debate around it at the moment, but I want to flag it up because adverse child experiences are what we are looking for. And we need to begin by empathising, asking about the needs, the stress levels, and asking about the absences, and then also, how can we help? Let's be proactive here. How can we help? Not how can we judge? How can we demean anyone? How can we help? And understanding what toxic stress actually does to the brain, understanding neuroscience, clearly vital here. Okay, so we know prolonged activation of the stress response system disrupts the development of the brain architecture and other organ systems, increases the risk for stress-related disease and cognitive impairment. What does it actually mean for the chronically absent child or children? Many of them live in poverty, many are affected by the presence of addiction or mental illness in the home, and some have incarcerated parents. So they have this constant activation of the stress response system. And I would also now add into this that some of our children are at risk of toxic stress due to these factors combined now with the impact of this COVID pandemic. So toxic stress in essence means your brain, your mind and body are constantly working. And these kids very often, when they're exposed to continued levels of toxic stress, can be perpetually tired, cranky, aggressive, and physically ill, physically sick. And I think it's really important. The disrupted brain development, increased risk of disease, those are givens. We know this from the research now. But just thinking about this level of stress and the impact that it has on how the children or the child presents in school is very important. So re-examining this, looking at this in the light, in the frame of toxic stress is very important. School refusal versus truancy, re-examined in the light of toxic stress. Chronic toxic stress, that hyperarousal, the flight response that the child has, the level of anger, the fact that they're argumentative. But sometimes at this point, at the beginning of this toxic stress journey, I would suggest, they can feel somewhat relationally engaged. They have some buy-in to some interventions, and some of them might do good schoolwork and some homework with encouragement. They still care about those relationships. There's a level at which they still have some buy-in, but they're trying to protect themselves to avoid hurt. So it's very important that at the outset of toxic stress, this is what the child's behaviour, young person's behaviour may look like. But as it continues, as it deepens, there's going to be more of this hyper-arousal in terms of behaviours and seemingly nonsensical responses, things that don't actually make sense when they're responding to what they perceive to be a threat. And of course, physical, mental illness, anxiety, depression, impulsivity, low energy, and more absences at this point. The absences will increase at the point where toxic stress, chronic toxic stress continues. And actually, this is about self-preservation. Very often when we're talking about resilience, I get quite upset when people describe children as being particularly resilient when they've experienced a lot of toxic stress. Oh, this child's been in foster care. He's been in 6 different placements. He's such a resilient child. Look at him. He's still managing. Actually, no, that wasn't resilience. That was survival. I just want to flag that up. I think it's really important. At this stage, the student will disengage, they'll be difficult to re-engage because they feel powerless, they've lost a sense of autonomy, and they're trying to find things that keep them feeling alive and worth something. So these can be both adaptive and maladaptive at this point. And also, once toxic stress is seen as the new normal, this is the way in which I function, this is when the child moves into what we would call safety ethic. They appear to be non-caring, difficult to engage, they're not really buying in. And this is about self-preservation, what I called survival early on, not resilience, survival. Schoolwork and homework are irrelevant. They will just do what works best for them in terms of their behaviours. And unfortunately, lying, stealing will lead to a level of truancy. And truancy in children and those who exhibit this emotional school-based refusal can have some overlap. So it really, really is important to remember school refusal or EBSA in the face of toxic stress can become, in essence, truancy. And what we really, really need in order to prevent this is early, effective and comprehensive intervention. And really key to this effective intervention is ensuring more secure attachments. And we know about attachment, we know about ambivalent, avoidant, disorganized attachment, etc. The commonality here is that there is a lack of a secure base for the child or young person, and what we have to do is to begin to secure that attachment, and that is two-pronged here. It's about building more secure bases both at home and at school, so safety, nurturing, secure bases in line with the 6 principles of nurture. And then, of course, teaching the affect regulation through co-regulation with the child or young person. And please look at the Beacon House resources, absolutely excellent on this topic. And in my view, co-regulation is an essential. And I would suggest that there's a possibility that many of us could do this much better than we currently do it. That involves understanding and managing anxiety, our anxiety and theirs, supporting them, knowing the neuroscience, as I said earlier, understanding this. Because actually that makes us kinder, doesn't it? It makes us understanding. It gives us a sense that we can be compassionate because we see and understand where the behaviour is coming from. We need to know how to use emotion coaching, and please make reference to my CPD Coffee time on that particular topic, emotion coaching, emotional literacy. Very, very important. Engaging in authentic listening, non-dismissive of the child, and knowing techniques to self-soothe ourselves and modelling these with the child or young person and for them. Using what I call the language of compassion and kindness is absolutely essential here. We need to adopt this no blame approach here to these children, young people, particularly at this time. And may I also suggest possibly towards parents too, a little bit more kindness and understanding, because you know we are all anxious here. We need to be developing the kind of therapeutic, supportive relationships that can help build that strength back again and ensure that children feel safe and able to re-engage. I take this directly from the wonderful Margot Sunderland's work, who I have been aware of for many, many years, and I have worked with her, and I would just say this is really key to this, in my view. The aim of this therapeutic relationship that children need now, if they are not going to become emotionally based school avoiders, is to ensure that they have this adult to share calm with. So sharing calm. But if we're going to do that, we need to be regulated. And as regulated adults, if we're aware of and attuned to our own emotions and responses, we sense our body states and ask questions that help us to respond in what Margot calls a trauma-reducing, not trauma-inducing way. So look to yourself, please. We know that dysregulated, stressed adults can't effectively support and help children and young people who are also dysregulated and stressed. It's absolutely impossible. So we need to be more resilient and trauma informed. And I use resilience in a positive way here. We need to have these elements in our own toolbox ourselves, in our own knowledge base, if we are to effectively share calm, which is what this is all about. If we want our children to not become school avoiders, emotionally based school avoiders, then I think we've got to be very, very clear about this. We have to be able to effectively share our calm. And doing that means that we understand the language that we need to use in order to calm an anxious, traumatized child, what to actually say, because our language and our tone matters. And I thank Pookie H for this. Again, wonderful. I'm going to make reference to her again in this presentation. She has a wonderful session on emotionally based school refusal, she calls it. She talks about safety. So in the first instance, making sure that that child knows that they are safe. I'm here for you. I'm staying here. You're going to be okay. I'm going to be here for you. And then physiology, understanding, helping the child to understand how this impacts in their body. It's going to pass. Your body's responding in what we would call an anxious way. Give it a minute or two and it will pass. You've been through this before. You can do it again. Then validation. This must be so hard. I'm sorry it's making you feel so nervous. It sounds really difficult for you. Do you want to talk it through? It's not actually silly that you feel like this. I'm not going to dismiss your feelings because I can see you're worried. How can I help you? What is it that I can do to support you at this current point in time? And again, this in essence is emotion coaching, okay? Nurturing emotion coaching. And as I said earlier, understanding anxiety is clearly an essential to this whole process. So understanding what anxiety looks and feels like and how to support a child with it has to be in place. Those anxious feelings about school lead to negative thoughts and one's ability to cope. So what do? You avoid the situation because it invokes the anxiety. Immediately your anxiety reduces, but then you are increasing the school avoidance. It's almost a vicious cycle here, okay? So you're falling behind in the school work, you're losing your friends, feeling more isolated. So that gives you more anxiety around school. The pleasurable activities at home are much, much nicer and feel safer and more comfortable, but then that decreases your motivation to go back. So think about this again with a COVID lens and the implications that this has now for our children and young people going back. Anxious about going back to school. I'm worried that I won't be able to cope in my new bubble. I'm worried that I might get the virus from other people. I'm worried that I might have a teacher I don't like. So what happens then? I'm going to avoid that. I don't want to go into school. So immediately I'll be at home with my mum and dad. My anxiety reduces because I'm again in my nice little isolated bubble, and that increases my school avoidance. So what we need to do is move into what I would call social engagement with chronically absent students, with those who are avoiding the school for emotional reasons. We remember that anxiety response is activated, and remember this too, we can't talk a student or a child out of this. You can't talk them out of it. Okay, that represents a kind of safety for them. What we need to be doing is building more secure bases so that we become the safety for them and show them that we can regulate even if they can't. We never respond to anxiety with anxiety or anger. And that can be very, very hard if you're an anxious mum or dad and you are trying to support your child back into school. And this is why this whole notion of us looking after ourselves and managing our own anxiety and being able to self-soothe is absolutely vital. We cannot respond to anxiety with anxiety or anger. That's an absolute given here. So if you want to look into this in a bit more detail, again, go back to my second session, CPD session on anxiety, but also look at the session on self-care. So ultimately doing what works. The primary treatment for children with school refusal or EBSA is an early return to school. Actually, not psychology. This is just plain common sense. So what we've got to do is provide a quick return to school, because the longer that the child is out of school, the harder it is to return. And also extensive support, not tokenism, not something that's just, a little bit of a program that we're going to just slot into place now. It's got to be extensive, because without this support, the anxious child will experience really overwhelming anxiety. And that will again reinforce the benefits, supposed benefits of staying at home. So ensuring interventions for managing anxiety, absolutely vital. So thinking about how we actually work with the child to recognise their anxieties, to problem solve, to make use of self-soothing strategies. I'll come back to this later in the presentation. So return to school during this pandemic is not going to be supported simply through access to counsellors, even if an army of them is deployed. And I know that currently there is this talk around the government's commitment to providing a considerable sum of money so that all schools can now access therapeutic input. These might help some children who are in a place where cognitive processing is possible, but actually the relational milieu, the therapeutic web of kind human connection, these matter much, much more to children at this point in time. And the majority of the kids who are at risk of school refusal or EBSA will need regulatory activities. And in fact, all of us do, all of us human beings do, if we're able to maintain a healthy baseline of stress, which is consistent with what Dr. Bruce Perry's bottom-up model of therapeutics suggests to us. So I think it's really, really important. It's got to be something systemic. It's got to be something within school. Children need to be nurtured and supported and given regulatory activities by those who they know, and those who they know are there for them and have been there for them previously. It's about relationships. So what helps in school? Early identification, quick response to re-engaging, positive relationships with staff, peer relationships which are positive, having a designated retreat area if the child feels under threat, having an empathic, available adult to talk issues through with, but available, not someone that's just once a week. This has got to be much more intensive for some of our children. A real planned transition from primary to secondary, as I said earlier, and trusted adults who can negotiate the timetable and maybe offer this more flexible approach step by step that many of our children need. So think about the reference I made in my anxiety session to the anxiety ladder, step by step, this kind of gradual desensitization or exposure. Lack of bullying also is a clear essential, and opportunities to engage in extracurricular activities, activities that make the child feel good, positive, a really well organised and responsive SEN department, and schools where staff are genuinely aware of the issues and are trained sufficiently in how to deal with them. So this kind of therapeutic relationship and understanding of the neuroscience and what behaviour actually means when it's exhibited. So what can we do? 10 tips here. Tip 1, creating this predictable, consistent environment, explaining the expectations, clear boundaries, and those which are understandable routines, which are communicated to everyone, not just to the child, to the parents, to everyone who is engaging with that child or young person. Tip 2, everyone involved with the child needs to be authentic in welcoming them back. Kids know, they pick up when it's not genuine, when you're actually thinking, I really don't want that kid back, actually. I'm much happier when they weren't in my group or in my bubble. I think that's very rare, hopefully, nowadays, because I know that the teachers I work with are hugely compassionate. I think we need to let them know that we're really happy to see them. And again, many thanks to Pookie H here, because this is taken directly from her work, this notion of share it, shelve it, shout it. I loved it so much, Pookie. I've put it in here on this slide. So enabling readiness for learning by reducing heightened emotional states. So when I'm feeling that level of anxiety, I'm feeling that hyper arousal, share it, talk about the worry. Shelve it, schedule time later to talk about it. So have worry time, designated worry time planned in, maybe just before break time or just at the start of lunchtime, etc. Shout it, engage in physical activities to release that worry. So providing time for the child to actually have a run around, be able to do something physical. Tip 4, building in regular times throughout the day to engage in activities which reduce emotional arousal, helping the child to feel safe via self-soothing. So having that calm box, I made reference to the calm box and grounding in my anxiety session. So tip 5, basically here, teaching self-regulation, skills, training and therapeutic strategies for anxiety. I made reference to this in my session on anxiety, so I'm not going to go into it in too much detail, other than to say that all of these self-regulation skills, mindfulness, deep breathing, grounding exercises, cognitive restructuring, activity scheduling, visualization, noticing exercises, etc., all of these within the framework of a positive psychology curriculum should be what we are actually teaching children to do, giving them this toolbox so that they can self-regulate, but also we need to be able to do it ourselves. So as I said earlier, we can co-regulate with the child and model self-regulation to them. And tip 6, we need to work respectfully with the family. And I use that word respectfully. It's really, really important. If we're going to enable honest and open communication, we've got to ensure that there's a no blame culture and approach, because it's very hard for them too. And think about how stressed the parent is when the child is stressed too. So we need them to feel that as the educators, we've got their back. Developing a special signal with a child or young person is also really, really important. A special permit card or um, BSL, whatever we're going to use here, there's going to be a way in which the child maybe can give us that private sign or signal to say, I need some time out, I need some space here because I'm beginning to feel hyper aroused. And tip 8, making those break times restorative, planning activities, things that the child can do with a clear structure or routine. So something special that has a real clear framework around it, and that is really supporting them to engage in activities maybe in a pair or in a smaller group, but something that makes them feel safe and secure, and it's very, very routine, so they don't feel that they're suddenly exposed to a whole different context in which they're finding a bit frightening or overwhelming. And many practitioners that I've worked with over the years, and this was something that they developed in the London Borough of Hillingdon way back in, I think it was year 2000, I was working with the specialist teaching team, the behaviour support team. What was actually very, very useful was to provide specific Sunday evening plans with the family and a special Monday morning plan. And this was usually done by the member of the behaviour support team who was working with the family and the young person directly, trying to get them back into school. So I think this is really, really useful. And Pookie H also raised this in her session on emotionally based school refusal. And I think what I wanted to do is try and develop my own framework. So I'm going to present to you two different frameworks that I have developed. So the Sunday evening plan, again here, I've used the word Sunday obviously to frame this. So soothe, so do some calming activities. So that the last thing at night before the child or young person goes to bed, there's something that they're listening to that's gentle music or a story for younger kids. Softer lighting, talk about maybe 3 good things before bed so that we're focusing on positive, something that was really lovely that happened that night. Understand. Make sure you let them know that you do understand their feelings. You're not going to negate them or dismiss them. You know how hard it is, but you also know it's going to get better in time. So give them a sense of hope. What's important is that you are able to develop your own script for this, if appropriate. Neutralise. Record any worries in a worry book, then talk them through each one. So helping the child to see a solution where they're catastrophizing, or show them the evidence against any irrational thoughts or thinking patterns. So make it clear, show them the evidence. Decide. Decide on a plan of action and go through it step by step. This is what we will do tomorrow. Work out the schedule and ensure that everything is ready. The book, the bag, the PE kit, etc. It's all laid out for the next morning ready. Make the plan visual. Make a visual timetable for this if needed. Attend. Always be vigilant to the child's emotional state. Give more time if they need it so that they feel nurtured and safe. Give reassurance and a transitional object for younger children. Yourself. So important. Never forget this. Look after yourself. Make sure that you're regulated and feel calm yourself. Engage in some relaxation. Take some time out after the bedtime routine so that you build up your own resources, and remember that it's okay to feel worried, but don't let it overwhelm you. And the Monday morning plan, if you are the parent carer supporting your child to go back to school. So first off, manage. Manage yourself first. It's not selfish. You can't support your child or young person if they are unregulated and stressed. If you are too, I've said this about 3 times in this presentation. So take time to sort your own needs and then manage your emotional state by using your usual stress management tools. So grounding, time alone, mindfulness, whatever you do. Organise, get everything ready by getting up early, dare I suggest it, so the bags are in the hallway, the breakfast is set up, you've got your own things sorted for work or whatever you need to get organised. This means that you can attend to the child and do so in a regulated manner. You don't have all these other things that are worrying you at that time. Neutralise. Spend some time with your child talking through any worries and again helping them to see a solution where they're catastrophizing. Show them the evidence against any irrational thoughts or thinking patterns. Then decide. This is the plan. Make it clear to them you've got a plan to get to school, how you'll get there, what music you might listen to in the car or stories you might tell each other on the bus as you walk, who else might be with you, etc., so that it all becomes clear and they feel prepared for each step of the way. Accept. Accept the child's emotional state. Give them the reassurance that you love them, you care for them, so that they feel nurtured and safe. Give reassurance and a transitional object, perhaps for your younger children. It's okay to feel anxious, but we all need to manage it, and I will help you. I'm with you. I'll stay with you while you need me. Yourself, again, look after yourself and make sure that you're regulated and feel calm yourself. Engage in some relaxation and remember it's okay to feel worried. Just don't let it overwhelm you. Keep using the script. If I stay calm, I will make him or her feel safe. I need to share my calm. I would just like to point out I'm going to use both of these scripts as part of a publication I'm currently working on for Hinton House Publications, which is going to be hopefully called The Essential Guide to Emotionally Based School Avoidance. So look out for them there. They will be presented in that publication. And tip 10 here, celebrate every success, no matter how small. And this is really, really vital, because sometimes what we have to factor into our thinking is this will be a very step-by-step process. So moving from the parents to us as the school-based practitioners, what we have to think about is the process for us in terms of gathering and analysing the evidence and then developing a support plan for the child. And I always think that this is the best framework. Assess, plan, do, review. So gain a full understanding of the various aspects at play here within all of those contexts. So holistically, plan based on that information for a realistic, I say small reintegration. Listen, it's step by step here, very important. Then ensure all the resources are available, the good communication is maintained, and then review and adjust the plan. Thambaraja et al. Highlighted the main aims of this kind of analysis as confirming that the child is displaying school phobia or EBSA, which is emotionally based, i.e. as opposed to truancy or parentally condoned absence, to assess the extent and severity of it, to gather information regarding the child, family and school factors that might contribute to it, and to synthesize this information in order to develop a practical working hypothesis which can inform the planning of an effective intervention for that child. And please, 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 whatever you do in terms of this process, it needs to start with discussing this with the young person. The child's view, the child's voice needs to be heard here. And this needs to be step by step, using that hierarchy. So we're actually facing up to these fears step by step, bit by bit. So gradual exposure. Maybe using a life graph, using things like the thermometer, step-by-step process. So far more in depth, you will find this whole process discussed in the module 10 from the new Wellbeing Toolkit for Mental Health Leads from Hinton House. So in effect, what we do is develop a support plan in 10 steps. And again, as I previously said, this is outlined in more detail in the Module 10 from the Wellbeing Toolkit for Mental Health Leads. So thanks to my colleagues, co-authors, Dr Jo Wood and Dr Amy, such wonderful people to work with. So please have a look. There's a detailed framework for this in that module. So step 1, clarifying whether it's school refusal or truanting. Then undertaking a comprehensive assessment, asking all involved for their views and making use of appropriate psychological tools or assessment processes. You may consider using a child-specific rating scale such as the Spence Anxiety Scale. Then you make sure you know what the possible triggers might be. Really ask, what are these? What's triggering this? What's happening where? Who is around at this current point in time? What is the impact of those relationships, etc. Step 5, you need to rule out any underlying physical illness. So that involves talking to parents. Step 6 needs to be a really comprehensive assessment of what is actually contributing or might be contributing in the school. Is this around specific areas of learning, particular areas of the curriculum? Is it around special needs which are unidentified? Is it around relationships with peers or bullying? And let me please just emphasise the fact that bullying very often comes up as a significant issue within school. So is there an underlying psychiatric disorder? Again, this needs to be factored in. This is part 7 or step 7 of the process. Are parents contributing to this problem? Is there an element at which mum or dad or someone else in the family is ensuring that the child can stay at home because it also makes them feel safe? Are there carers commitments that this child themselves has that have not been identified? So that needs to be flagged up very sensitively and carefully. Step 9, we need to provide parents with advice on supporting their child, managing the anxiety. So not just the Friday night, Monday morning plans, but ongoing advice and support around actually how to discuss these issues with their child, how to help them self-soothe, how to gain those skills themselves, and also how to access additional support should they feel it's needed or appropriate. And of course, referring the child to the CAMS service should you feel this is appropriate. If you really are thinking that there are psychological issues which are pretty significant here, that has to be something that we make use of as a process, and making reference obviously through and via your school's mental health lead or SENCO or inclusion manager. So just to emphasise that having set up this whole process, having gone through these steps and ensured that the assessment process is really, really sound, we need to make sure that we really factor into our thinking that it has to be gradual, okay? One step at a time. And I know this is difficult in the context of COVID, particularly to allow parents to attend and slowly phase them out. But I think it's really, really important. We need to attend to parental anxiety. And if we cannot have parents in the school, I know we can't at the moment, there's got to be a way in which we can have some kind of system that they are taking the child to the school gate, that they are there, that they have a transitional object for the child, etc., etc. And I think as well, maybe even providing that child with some FaceTime just on the phone with the mum or the dad or the carer at lunchtime or in a break time, just to check in, to make sure everything's okay, to reinforce the fact that you're proud of them, that the parent is making sure that this is all okay, everyone feels secure, everyone feels safe, and it's all going okay. It can be really, really important, this, and I think sometimes in schools, some educationists I've worked with in the past have been very kind of wary about this, but I think we need to move away from that. This isn't fluffy stuff now. Children are going to feel very, very anxious, some of them, and we need to make sure that if this is what is needed, it is what they get. So when I say ask the child, get the child's views on this. It might not be appropriate for all of our children, but there might be a small minority where this is something that we need to ensure happens for them. What's essential is that it's gradual. We avoid flooding too much too soon. It will only reinforce this school phobia or the EBSA. So bit by bit. And that for some of our children might be much more gradual than we at first think it would be. So again, the importance of language for parents, carers and us as the educationalists. The message has got to be clear. We don't blame you. We understand that you're stressed, you're anxious, you're upset, you're frightened. We want to hear about this on your terms. And then we need to ask ourselves, please continually, do I contribute to a sense of safety for this child or young person? Because actually this is what they need, with the words that I use. And I posted this lovely visual on Twitter yesterday. I'm recording it. Oh, did I? Yes, I did yesterday. I don't know where I got it from. I couldn't find the reference for this. So whoever's provided this, thank you. I think it's beautiful. And it's so simple. Just, things that we can say to that anxious child, whether we are the parent, the carer, or the teacher. I'm here with you, you're safe. Do you want to do some dancing or running to get rid of some of this worried energy? Tell me about it. What would you like to say to your worry? What might your worry say back? Then what? Let's draw it. What does it feel like in your body? Where is it? How big is it? Match your breaths to mine. Help me. I'm going to co-regulate with you. Let me help you regulate yourself. Let's do this together. Let's think about some endings. So what could happen? So anxious ones, goofy ones, and really realistic ones. Let's challenge those negative automatic thoughts. And what's something that we could do right now to help you feel better? So this language thing is really, really vital and important when we are working with a child to reduce that level of anxiety. So ultimately, at this time, I think it's about the importance of connections. It's a lovely book here, The Invisible String. I just want to flag it up. It's not clearly for older children. For younger children, it's very appropriate. But the message is here, okay? We love you and we're here for you, even though we're not with you, okay? I'm physically distant. I'm away from you. I'm at home. You're at school. You're not alone in this, okay? We are in this emotionally together, and we can support each other, and we can help you overcome this. So to summarise, what we need to do for all our children, young people who are beginning to display symptoms of emotionally based school avoidance, we need to assess holistically, including everyone, and hearing the voice of the child is paramount. Safety has to come first, as do connections and access to key emotionally available adults, people the children can talk to and engage with and feel that they can engage in co-regulation. We also need these trauma-sensitive adults and systems, and I make reference here to the wonderful work of Chris Moore and his 6 keys. Please look back at this, because it's absolutely sterling stuff. It needs to be bespoke and child-centred to that individual child. So some children's progress on this is going to be much more gradual, and we need to, differentiate here big time, I think, step by step, with compassion, building this plan together, this team around the child approach. So ultimately it's about listening, loving, and promoting hope for our children and young people at a time when many of us are experiencing heightened levels of anxiety and fear. But the way that we overcome that is by listening and loving and promoting hope within ourselves and each other. So some very useful links I just want to flag up at the end of this. I'm particularly minded here. Very useful set of resources, including School Refusal or EBSA, also Young Minds and Relate as well, and Hands On Scotland. And some key references or bibliography here also if you wanted to follow anything through. So thank you very much once again for listening. I hope this has been really useful, and thank you to all the people who were inspirations here: Pookie, Chris, Amy, Joe, Margot Sunderland. I really value everyone's views and input, and I think at this time it's hugely important we work together as professionals, as those who really do genuinely focus on the mental health and well-being of our children and young people, that it's something collegiate. We work together to ensure that what happens next really does make a difference and helps to support a really nurturing, safe, compassionate return to the school context and prevent the escalation of these kinds of emotionally based school avoidance behaviours. Thank you.